We have a combination of adults, university students, and high school students.
Well, it was great to be able to spend some time with Liz and Arlene and Christine. And you know, I found those discussions very impactful and very significant in terms of Hamilton Health Sciences being able to achieve some of our goals around the patient experience. Our volunteers make such a great difference here at the hospital by doing some of the little things that there's just no way we could resource without them. Things like helping patients go to a kiosk and be able to navigate through those screens. Things like helping patients find their way to whatever appointment it is they happen to have. And you know, 100 other kinds of roles that volunteers play across our clinical services, and on and on and on.
It takes the stress right out of them coming into the hospital because, you know, you realize when they walk in those front doors, it could be a little daunting for a lot of patients coming in.
Yeah.
And it kind of relieves that stress part about it.
And so for you as a volunteer, what role do you play in this?
I act as a helper. I assist the patient to understand why they're doing this, get them to do it. For instance, if a patient has a language barrier, we try to answer the questions, read the questions, have them understand the question so that they know that what they're answering is what they're feeling. A lot of patients come in and they don't understand that a doctor uses these kind of systems as well in order to help them in their assessment as to what their treatments are going to be. So we try to bring that to them. My daughter actually had lymphoma cancer in 2013.
I'm sorry.
So she's doing fabulous. She's healthy and strong now. But I spent a lot of time at the cancer hospital in Toronto. And so I felt that this was part of the reasons that I wanted to assist here in treatment with the patients here. I found that there was such a great need of it and not enough people to do it. So I thought, well, this was going to make valuable use of my time. So.
You know, it was interesting to me the personal connection that our volunteers described with the facilities that they were working in. I think many of the volunteers here at Hamilton Health Sciences have either personally or through their families been involved, had been patients or had family members as patients at the facilities. And clearly that's had a big impact on them and their desire to give back something to Hamilton Health Sciences. And I think those experiences really enable our volunteers to better understand what a great patient experience is all about and to help us to provide it for the patients that are currently coming through our doors.
I'm a wayfinder at the door, at the entrance, to greet the patients and help them go wherever they need to go or find the places they need to find.
So how many patients would you see typically in a day, do you think?
I would say roughly around maybe 25. I'm just here in the mornings for a half day, so I would say around that many. I was, when I first got involved, I was down at one of the hospitals with my husband, and we hadn't been in a hospital for a while, so when we walked in, it was huge, because we came from Nova Scotia, and it was a small hospital, and it was like overwhelming, sort of. Like we thought, oh, where do we go from here? And it was sort of stressful at the time when you're having something done anyway, right? So that's when I seen the sign about volunteering.
And what do you get out of it? Do you enjoy your time?
I do enjoy it. I do enjoy because everybody is so thankful for if you can help them. They really appreciate what you do.
I just wanted to extend a very big thank you to all of our volunteers for the work they're doing. I think we should all be very grateful to those volunteers for the role that they play here at Hamilton Health Sciences. We are really grateful for it. We would not be the hospital we are without our volunteers. So thank you very much, and see you all again next time.